Hi, everybody. Welcome to the session. My name is Sophie, and I'm going to be your trainer for today. Now, just while we are waiting for a few more people to join the session, I will just go over a couple of really quick housekeeping things. It won't take very long, I promise. So I will jump onto my next slide here. Alrighty, just a little bit about the GoToWebinar interface. You should have a screen that looks something like mine. Now, if we just start in the bottom left here, you can see that there is a little hands up option. If you want to send a reaction through, that's completely fine. Otherwise, you can just ignore that one altogether. Having a look along the bottom here, you'll notice that there is a microphone and a camera option. Due to the number of attendees that we have in this session, those ones will remain disabled, so it won't let you click on those. However, if you do have a question throughout the session, please do send them through. You'll just need to use the little questions panel up in the top right. So send me through your questions. At the end of the session, I will put all of the questions together and they will all be answered in a follow-up email. That just ensures that we use our time to cover as much content as we can during this session. Now, if you are having any issues with your audio at all, just click on the little cog icon up in the top right. Clicking on that one will open up a new panel and you can change the way that you have connected to the session. So for example, you can change to listen through your phone rather than through your computer. It's completely up to you how you do want to connect. Now, I will just give everybody a little bit of a heads up as well that I am recording the session for you today, and I will send you through a follow-up email that has that recording link. Now, that recording link, it doesn't expire at all. You can watch it back as many times as you need to. I'll also include a summary of everything that we covered today, and I'll have those follow-up questions in there as well. So we'll make sure that everything gets answered during this session. Having a look at what we're going to be covering today, for some of you who are pretty familiar with best practice, this will serve mostly as a refresher. However, hopefully you're going to pick up a few tips and tricks along the way. What we're really going to be focusing on today is data quality. So making sure that we're recording information in the correct places and that we're setting ourselves up well for accreditation. So we just have the 1 hour session today and we've got a lot to get through. So I will stop rambling and we'll jump straight into our content. I'm just going to close out of my PowerPoint here. Alrighty, now you should be able to see my computer screen here. I've got a patient file open and I've got a big purple mouse. All right, let's start with recording family and social history. Now, this can be updated from the patient's clinical tree, and then we can update the individual fields here, but I prefer to use as little clicks as possible. So what I like to do is wherever in the patient banner along the top here I want to update, I just double click on it. So if I double click on tobacco, you can see that it takes me straight into the smoking history. Filling out our family and social history is all pretty straightforward. So using family as an example, if the patient doesn't have any significant family history or if their family history is unknown, we can select the appropriate tick boxes and you can see that actually grays out a lot of the data. So it doesn't leave much room for any user error. But the two tabs that I do want to focus on in here for today is our alcohol and our tobacco tab. Starting with alcohol, this is where we can go ahead and we can record the patient's current alcohol intake and any past alcohol intake. Now you can see that if we mark this patient, as a non-drinker, that will grey out the current alcohol intake, but we can still fill out past alcohol intake. So again, not leaving too much room for any user error. But otherwise, we will go ahead and we'll fill out some example data in here, so just free typing. And you'll notice that we have some additional buttons along the bottom here. Now, the Cage Questions button will open a window with the screening questionnaire tool on drinking habits. Very straightforward. You're just going through here and recording the answers. When we click Save to that one, it will give us a pop-up with the outcome. And when we click OK, in our free text comment section, Best Practice has automatically recorded when we performed that assessment and what the outcome was. Next, we have our Standard Drinks button. Now, clicking on this one will open the window with a summary of standard drink sizes for beer, wine, and spirits. And you may just find this helpful when you are filling out that standard drinks per day field up the top there. The last button that we have along the bottom is our Audit C. Now, clicking on this one will open up another assessment tool. And once again, you just need to go through here and record your answers. However, as you're recording your answers, it will generate a score for you down the bottom. Now, if you want to see what that score means, just click on this button here and it will show you the interpretation of scores for both males and females. And you do also have those standard drink sizes listed in here as well. As a little bit of a side note with your Audit C assessment, that score will automatically be recorded in the patient's observations table as well, just so you're aware. We'll move down to our tobacco tab now. Now, if your practice is involved in incentive programs or NKPI reporting, the smoking history is one of its components. So it is worth keeping an eye on this section to ensure that that information is being recorded. Now, we'll go ahead and we'll mark this patient as a smoker. And then, as always, we just go ahead and we fill out our details in here. So that's very straightforward. And down the bottom, you've got a free text comment field as well. You can just use this field to fill out any additional details that might not fit into those fields above. So that's very straightforward. So I've filled out my details in here. I will click Save, and you can see my patient banner has updated along the top here. And then in my Today's Notes section, Best Practice has automatically recorded everything that I've just updated as well. Now we'll move down a little bit further and we'll have a look at recording our allergies and reactions. Auditors will usually check the information recorded under allergies and reactions for accreditation purposes. So it's really important that we do add this information for all of our patients. So I'll go ahead and I will click on this reactions button here to update the field. If the patient has no reactions to be recorded, make sure you're ticking this nil known tick box down the bottom here. And that way you will still be meeting your accreditation requirements, whereas you wouldn't be if you just had nothing at all filled out in here. In my follow-up email as well, I will send through a database search where you can find a list of all of your patients who have nothing at all recorded in here. And then you can go back and you can fix up those patient files where required. But we will go ahead and we will add an allergy for this patient. So I'll click on my add button here. Now there's a few different ways that we can search for an allergy. We can search based on drug class, so that's all drugs found within a specific class. We can search by active ingredient, so that's a specific ingredient found within a drug. We can search for a specific product. That's our specific drugs by trade or generic name. We can search from our non-drug list. And we do also have a free text option as well. A little bit of a side note or a disclaimer regarding free text in here. That's completely fine to do. Free text items will still impact your prescribing. However, only products containing the exact spelling of this ingredient will get a warning. So in summary, just make sure you're being careful if you are free texting in there. But let's go ahead and let's add an allergy for penicillin. So I'll search from my provided list. I will choose my nature of reaction. And because I have selected anaphylaxis specifically, my severity has automatically set to severe, and then I can enter any additional comments down the bottom there as well. So I'll go ahead and I will click save and then save again. You can see that my allergies box has updated up the top here, and best practice has recorded what I've just updated in my notes. So any questions about that at all, just send them through in the little questions panel there. But we'll jump over to the right now and we'll have a look at our notifications window. Now, in the notifications window, you'll see a list of items that need your attention. And depending on the notification type, these ones will be displayed in different text colors. Now, when it comes to reminder and recalls, it's important to highlight that best practices definitions are aligned with the ones from RACGP. So clinical reminders are created in relation to a recommended preventative activity. For example, if they need to come in for a flu vaccine. Whereas recalls are created as a follow-up in relation to a result. We'll go through all that a little bit later, so don't stress about that for the moment. Now, this patient has quite a lot of notifications in their notification window. Let's have a look at the different types that we have in here. Outstanding requests indicates that we've created pathology requests, for example, but the results haven't yet been received. So these ones are displayed in a blue font. Now, generally you would verify and tick the ones received from your investigation inbox, which we'll have a look at a bit later as well. However, you can double click on this notification. That will give you a pop-up showing all of the outstanding results for this particular patient. And if some of these actually have been received, you can also tick them off and mark them as received from here as well. So I'll close out of that one. The next thing that we'll see in the notifications window are clinical reminders. And these ones are displayed in red if they're overdue to be sent out. But if your practice is on top of sending out clinical reminders, you won't see any red in there. And they'll be displayed in blue if they're due to be sent out within the next 30 days. Now, if we want to see all clinical reminders scheduled to go out for this particular patient, what we need to do is we need to click on reminders up in the top right, and we can see them all listed in here. So from here, we can go ahead and we can create a new reminder, and we need to fill out our details in here. I'm going to leave this top section as is, and then I can just select my reminder reason from the list. Now, your list may look different to mine because this can be customized, but you'll notice that when I select a specific reminder reason, it automatically sets the recommended reminder date for me. However, I can go ahead and I can override this. So I'll set this one to, I want the clinical reminder to go out in 3 weeks. You'll notice that we do also have a free text section here. If this is grayed out for you, it's because your practice manager will have turned it off for your practice. So that can be turned off completely. The reason that some practice managers do choose to turn that off is because if I were to free type breast check in here, even if I use the exact spelling of something that is already in the list, it's going to create a duplicate entry that will need to be cleaned up. So sometimes we just want to avoid that altogether, so we'll turn it off. The reminder comments section may also be grayed out for you depending on your practice's settings. However, anything that you type in this field, if it is enabled, will not be sent out to the patient in a text message. So you can use this area to record any sensitive information. That one also doesn't require any cleanup. Now we're going to pause this screen here for a moment, and I'm just going to show you the cleanup tool for if you are free texting. So I'll jump into the home screen of best practice, and then I'm going to go to setup, down to configuration in the drop down, and then we'll go into our reminders tab in here. Now, this is where the list of reminder reasons can be configured. So we've got our add, edit, and delete options here. And this is where you can also locate the cleanup tool. This is also where those free text sections are enabled, but anything that you change in here will affect your entire practice. So possibly leave that one to your practice manager, but I'll cancel out of there for the moment. Okay, we'll jump back into Bonnie's file and we'll continue with adding this reminder. Down in the bottom right, we do have a bit of a shortcut here. So let's just say that I want the first clinical reminder to go out in 3 weeks, but after that, I want them to get this clinical reminder once every 2 years. Rather than me remembering to manually add that every 2 years, which just isn't going to happen, what I can do is I can select this tick box here. I can set my update interval, so I'll set it to 2 years. And that's it. Then I can click save. Now you can see that this is giving me a pop-up, just warning me that this patient does already have a reminder in the system for breast check. You'll notice pop-ups like this every now and again if you're creating a duplicate entry, for example, but it's not an error per se. It's just asking if we're sure we want to continue. So we can override this one and we'll click yes. Now, in your clinical reminders, if, for example, a breast check had just been performed for this patient, we don't want that reminder to still be scheduled to go out. What we can do is we can right click and we can mark it as performed or no longer required, which will remove it from the schedule. Now that will only remove the next one to go out. It will still send the next reminder cycle, so once every 2 years using this example. If you want to delete it altogether though, you would need to actually right click and delete the item rather than marking it as performed or no longer required. We'll keep scrolling through our notifications window and we'll have a look at a few other options in here. Now, another thing that you'll see in the notifications window if you're using them are actions. Actions will not be communicated to patients and they can be considered internal tasks to be performed on the patient's behalf. So if we wanted to add an action, we just click on the actions button up in the top right. And you can see that this somewhat looks like a to-do list in here. So we can mark things as performed and we can also add a new one to the list as well. So we'll close out of that one. The next notification that we can see in here are preventative health notifications. These ones are shown in green and they're automatically generated by best practice. So based on the patient's age, gender, past history, immunization history, the system will just create prompts for things that could be considered for this patient. They're not sent out in a text message at all. It does all work in very nicely with the software. So if, for example, with this patient, we have a preventative health notification that an influenza vaccine is due, if we were to actually record that in the patient's file, that would remove that notification. However, if you do need to manually exclude any of these for whatever reason, you would need to come into preventative health up in the top right and tick what you want to exclude for the patient. Now, that manual process can only be done per patient. It can't be done in bulk for the entire practice. So we'll cancel out of that one. We'll move down a little bit further now and we'll have a look at the main section of the patient's clinical file. So you can see in my clinical tree, I have today's notes open. This is very straightforward in here. I'm sure you're all already across it. If we need to backdate our visit date, we can do that up to 30 days, but I'll just leave mine on today. I do just want to give you a couple of time-saving tips and tricks in here though. Now, you'll notice that we do have a history and examination panel on the right-hand side. This can be used to help you record notes that might take a little bit longer if you are just free texting. So what I'll do, for example, is I'll double click on my general tab And rather than me free texting, I can just go ahead and I can fill out some example details in here. Another great time saver is filling out your observations in this section here. So not only will it record the observations in today's notes, but it will also automatically record them in the patient's observations table. So you don't need to go back and do that separately. I'll just fill out some test data in here. And you can see that's put it nicely into my notes. If I were to click on my observations table, you can see those details have been recorded. It's automatically calculated the BMI for me, and I've got my Audit C results that we filled out earlier as well. Another shortcut that you're more than likely already aware of is using your own keyboard autofills. Now, if you do need to add additional autofills on top of what you already have in the system, from any patient's clinical file, so it does need to be set up from a clinical file, just click on your autofill button along the bottom here. We can click to add a new one, and your list is going to look different to mine. And you can create it from in there. Just remember, if you are using a common word like flu, for example, every time you type the word flu and click your spacebar, it's going to put that autofill in there, which might be a little bit annoying. So you might want to put an asterisk or something after that. And you can choose if you want to make that one available to all staff members or just to yourself. You can add tables in here. So if you fill out your notes in a table, for example, just create the table externally to best practice. So in Microsoft Word, for example, and then copy and paste it in here. So that's a little cheat that I've picked up along the way, but we'll cancel out of that one. A really important topic that I do want to cover while we are in the today's notes section is recording coded past history. So this is really important for accreditation and if you are participating in PIPQI incentive programs, for example. Now, if we need to record a diagnosis for today's visit, we need to click on the diagnosis button along the bottom here. From here, we will search from the provided list and we need to double click on one of the options in here. So if I just click once, you'll notice that it doesn't record it up the top here. But when I double click, it will. So that means it's clinically coded. If you're just free texting along the top here, it's not going to give you an error, so it doesn't stop you, but it's not going to be clinically coded. So it's just something that you need to be aware of. Once we've done that, we just fill out any additional details and we do have some time saver tick boxes along the bottom as well. So for example, if we want to add that straight into the patient's active past history, or if we want to also record it as the reason for visit. So we'll click save to that one. Recording a procedure, exact same process. So we click on procedure, we search from the provided list, we double click on an option, fill out any additional details, and we'll click save to that one. Now, you may not always necessarily need to be recording a diagnosis and or a procedure during a consult, but you should always be recording a reason for visit. If you do want to record a reason for visit manually throughout the consult, just use the reason for visit button along the bottom here. Search from the provided list. We do have really standard options in here like pain and medical certificate, so you'll more than likely find what you're looking for. However, if no reason for visit has been recorded throughout the consult, when you finalize the visit, it will actually pop up with this same window prompting you to enter a reason for visit. So it's really not something to stress about. Now, I do just want to show you how we can clean up those uncoded past history items. Sometimes, even though everyone knows how to record them properly, they can just slip through the gaps. It's easy to forget. But that's fine because we do have a cleanup tool, and I do recommend doing this ahead of accreditation. I do also recommend that somebody from the clinical team does this because it is to do with clinical data. Now, in best practice, we have something that's called BP utilities. It's located externally to the software, but it's automatically installed with the software. So you're already going to have this on each computer that you have best practice installed on. I've created a little shortcut on my taskbar so it's quicker to open, but otherwise you just need to click on your Windows start bar on your bottom taskbar there and start typing BP utilities. It will come up there under best match. So I'll open that one up, and it's then going to prompt me for my normal best practice login. And then you'll get a window with lots of different icons in here. There are some basic ones in here. So if we've deleted any patients and we need to recover them, or if we've deleted any contacts, we can recover all of that from here. Wherever you don't know what a particular icon does, I recommend calling our support team first to get some guidance, because there are some utilities in here that are only run if there's a particular issue with your database, and some changes can't be undone. But what I do want to point out in here is our cleanup history tool. So this is where we can clean up that uncoded past history. So we'll double click on that. You can see that I haven't been following my own advice, so I have quite a few uncoded past history items. If everybody has been free texting for the most part and nobody has come in here for a while, this screen can actually take a couple of minutes to load, and that's completely normal. It will just mean that you've got a big list that you need to clean up. So all you need to do in here is select an uncoded past history item and match it to a coded one. So I will search for contraceptive, I will match it to contraceptive oral, and then click replace. And you can see that that's removed it from the list. Next one, Rhineck, that's just been spelt wrong. So it really is quite easy to clean it up, but it's best if you record it properly in the first place. It leaves less work for you in the long run. So I'll close out of that one. And I will cancel out of there as well. All right, now we'll move a little bit further down our clinical tree. The next thing that I do want to talk to you about is prescribing. So we have two tabs that are associated with prescribing. We have our current RX tab and we have past prescriptions. In current RX, we'll see a list of the prescriptions that the patient is actively taking. And where we see a medication in red, so this one, for example, these ones are long-term medications that have been calculated to have been used in full. It's just the system making it stand out to you a little bit more to say, hey, the patient might have used all of this medication and it might be time for us to re-prescribe. Now, any once-only medications will auto cease and drop off this list after either 28 days or on calculation of the repeats being used. And once they drop off this list, they will then go into past prescriptions. Now, you can go ahead and you can re-prescribe from past prescriptions, or you can just reprint the same script if it has been lost. But let's go back into current RX for the moment, and we'll have a look at creating a new prescription. So I'm just going to right click on my blank space here and then select new RX. It doesn't matter if you prefer to click add or the pill bottle up the top here. It's all going to take you to the same screen anyway. Now, we do have a few ways that we can search for the product. So we can search by product name. We can browse by therapeutic class, and we can expand on the different options. From the custom option, this is where we'll see any compound scripts or over-the-counter formulations that you sell at your practice. And if you want to add these in, from the home screen of best practice, you just need to go into setup, down to custom preparations, and you can add them in here. So that's what we can see in that list. Then the last option here is favorites. So this is specific to you. It's if you've added any drugs to your favorites using this button down the bottom here. You'll see them all listed there. Now let's go ahead and let's create a prescription for amoxicillin. So I'll select my available formulation here. And in the box below, you can see that we've got further information on the schedule, PBS listing, restrictions, and clinical criteria. Now, at the bottom here, we do have some buttons that we can use for shortcuts. So we have same drug class. This will show the place in the therapeutic class list. Equivalent products, pretty straightforward this one. This will show similar products to what we've selected. The product information button will open the MIMS product information in a new window. NPS Radar, this will be available if there are any alerts or patient information leaflets relevant to the selected formulation. Allergies and reactions, this is a shortcut if we need to go in and we need to review those allergies and reactions, rather than having to cancel out of here and go back into reactions up the top there. Just a little shortcut. And then you have your CMI button. So this will open information about the consumer medicines information. So that's the leaflet information that the patients get when the medication is dispensed. We'll go ahead and we'll click on next. Now, previously we entered that the patient is allergic to penicillin. So if there are any warnings based on allergies or drug interactions for elite athletes or breastfeeding, this is where you'll get the pop-up. And this can just give us an additional safety net. Then you've got the option to choose again. But I'm just going to continue here. This is just a fake patient. Alrighty, now in this screen, we can go ahead and we can enter the dosage information. At the top here, we have the MIMS abbreviated product listing information. So you can scroll through here and you can check information about adverse reactions and dose details. And then we'll go ahead and we'll enter some dose details in here. Now the PRN tick box, checking this one indicates that the medication is to be taken as needed. Now, if you tick this checkbox, best practice does not consider the medication to be a regular medication for the patient. This here is automatically picked up by the database, so we can skip past that one. Any information that you record in the complex instructions field will be printed out on the label at the pharmacy. So you might copy information from the top section here and paste it down the bottom. You do also have a little shortcut option here. Now you can store complex instructions, and I'll just name that one as an example. And then next time, what you can do is you can click Insert, and then you can choose one of your stored ones in here. So that's an optional shortcut that you may like to use. Now, down the bottom here, product information and CMI is just the same as the previous screen, but we do also have this dose calculator. So this can be used for infant calculations. But we'll go ahead and we'll click next to this one. Now, under the availability box, we have the table for quantity and repeats. Depending on the options selected, the information in the quantity, repeats, and PBS listing will be updated. So I'll just keep the option for 20 selected. Moving down a little bit further, you have your consent to upload to ASL. So ASL is active script list. Keep this one ticked if the patient has consented to upload their script to their active script list. Active script list is a new way of viewing and dispensing a person's existing electronic prescriptions, but the patient may not want to have particular medications listed on there. So that can be unticked as needed. We'll move down a little bit further. The little note section here is optional, but from the list you can select one of the items. So that's very easy. Next, we have our mark for printing and our mark as printed tick boxes. So Tick mark for printing if the script needs to be printed or sent, and tick mark as printed if you've given the patient a handwritten script or if it's been started elsewhere. Now, if both of these tick boxes are unticked, the medication will be added to the patient's current medication list without generating a last script date. So, for example, that might be to record over-the-counter medication that the patient has started taking themselves, and you're not actually creating the script to send out to them, you just want that record in here. Now, before we can go ahead, we must select one of the mandatory options to indicate if it's a once only or a long-term medication. And this will determine how the system behaves when the script is calculated to have been used in full. So I'll mark this as a once only prescription and we'll click next to this one. The final screen here, the reason for prescription screen is optional. So it will let you continue on without selecting an option in here, but we can enter the reason for the prescription by selecting from the existing condition list, or we can add a new condition. So we'll go ahead and click finished. You can see that we've created our prescription here. Then we've got the option to print it, or we can send it as an e-script if we are using e-prescriptions. I do just want to create one more prescription with you. This time we'll create a streamlined authority prescription because this does differ slightly. So I'll go ahead and I will create a new prescription just as I normally would. I will search for Advantan, and everything on this screen looks the same, so we'll click next to that one. Then I'll go ahead and I will enter my dosage information in here. Any complex instructions as always, and I'll click next to this one. This screen, is also the same, so I won't go over that again. And then we just have this additional screen here. So this is where it gets a little bit different. Now, you'll notice that we have our authority approval hotline number up the top here, and then we have our approval number box below. So we need to get that approval number before we move on. To do this, we need to review the indications listed in this box, and we need to double click on one. The keyword being double click. Clicking once won't give you the number, so you do need to double click. So you can see that I've got my approval number there, and then I can go ahead and I can move on. Now, if it is a medication without the streamline arrangement, we can review the indication and double click on the applicable one. However, the approval number box will then show a letter instead. So it'll be the letter Z or M for Michael. Now from here, you can contact the approval hotline or use your Proto Online account to get the approval number and update the information in that field there. So then we'll continue on. We'll add our reason for prescription as normal, and then finished, and then we can print it or we can send it as an e-script. So it's just that one screen where you have some additional steps there. Okay, let's keep moving down our clinical tree. The next thing that we're going to have a look at is the results management process. Now, you can see in the investigation reports tab, I have a list of all of the actioned results for this patient. Now, we're going to take it back a few steps and we're going to see how they get here in the first place. So I'm just going to jump into the home screen of best practice. All right, now, when a result is pulled into best practice, it comes into this screen here, which is called incoming reports. So you can see all of my results that have come in. Best practice will read the patient name and date of birth on the report and also who it's addressed to, and then it will automatically allocate it to a patient and to a user. Once that's been done, It will be sitting in that user or that doctor's inbox, ready to be actioned. Now, in the case that best practice cannot automatically allocate the result, it will need to be manually allocated. So it's really important that somebody in your practice, not necessarily you as a doctor, but that somebody in your practice is coming into this screen, I would say every day, to manually allocate anything that has not been automatically allocated. Otherwise, it's just going to be stuck in this screen. It's not going to be sitting in anybody's inbox. What we can do here is we can tick show unallocated only, and then that will just show us everything that we need to manually allocate. You can double click on any of these to open up the results if you need to have a look at it. Otherwise, we can right click and we have the option to allocate to patient and also to allocate to user. So that's very straightforward. Now, if we need to allocate to a user, something that you can do is you can make this a permanent alias. So we could pretend that Dr. Kyle McDonald is on long service leave. So I want to reallocate this result to myself, and I'm going to make this a permanent alias. So that means for any future results that come into the system, it won't affect any results that are already in the system. If they're addressed to Dr. Kyle McDonald with that exact spelling, it will automatically be reallocated to Dr. Find a Cure. So that's a bit of a time saver. If, for example, Dr. Kyle then came back to the practice, I don't want any future incoming results to be reallocated anymore. So what I can do is I can go into view along the top here, down to aliases in the drop down, and I can just delete that alias. And again, that's not going to affect anything already in the system. It's just for any future incoming results after I've made that change. And then we can go ahead and we can allocate to the patient as well. So we can see the patient name and date of birth on the report, and then we can search to match it to an existing patient in our system. Now, once you have found the patient, you can just double click on their name, or you can click them and click on select, which will match them. If you're not getting any results, so if you can't find the matching patient in the system, try firstly searching variations of the patient's name. Otherwise, if you still can't find the patient, it may be a result for a patient who does not yet have a record in your system. So we can click on the add button here to create a patient record with the name that's listed on the results, and there'll be no other information. So you would just have reception, for example, open up that patient's demographics and update the rest of the details as required. But just make sure if you do find the patient that you're clicking select, not add. So you're not doing any unnecessary duplicates in there. But we'll cancel out of here. So once it's been allocated to a patient and to a user, it will be sitting in that user's inbox, ready to action. So that's just the little icon here that has the brown tray and the green arrow. Now, in the first column here on the left-hand side, we have a list of patients in alphabetical order. And all of these results will have what I like to call traffic light dots. So you can see we've got patients that have yellow, red, and we have some green in there as well. The traffic lights can assist in interpreting the results based on atomized data. So as you'd already be aware, atomized data has a range of values considered normal, and based on the values on the result, the different colors are assigned. So where we see a patient that has a green bubble, that means that the atomized data is within the normal ranges. Where we see red, that means that they have data that is outside of the normal ranges. So if you're really busy in your practice, you might choose to go through your red bubbles first because they have abnormal results there. Yellow can mean one of two things. So yellow can either mean that there's no atomized data on that document at all. Possibly reception has just scanned something into your inbox. Or yellow can mean that the atomized data is within the normal ranges, but it's quite close to the upper or lower limits. So you can see here as an example, 5.7 is very close to 6. That's why it's yellow instead of green. Now, especially if you are part of an accredited practice, the outstanding requests box is particularly important. Now, this will show a list of all of the requests that we're waiting on for this particular patient. And as we receive a result, we need to make sure that we're ticking off what we're receiving in here. If you've got a very good memory back to the start of the session, you'll remember that in our notifications window for our patient, we do have that outstanding request notification there as well. So that's linked together. But we'll go back into the inbox now. Moving down a little bit further, the comment section can be useful to communicate with the nurses or the reception team, for example. So you might type long appointment, please. You do also have this add to list button. So this is a bit of a shortcut. I'll just type in here. So I can add that to my list. And then next time, rather than free typing in here, I can just double click on an option from my list. Now, when using this comment field, just be careful if your practice sends SMS messages from best practice, because depending on how the templates have been set up, these comments might be included as part of the SMS message. But it really does just depend on the template that you're using. So for those cases, just be careful on what you are recording in here. Now, on the right-hand side, so we'll jump across here, the first section that we have is this result is. Now, this field is technically optional, so best practice will let you continue without marking an option in here. However, you must select an action to be taken before you do move on. Otherwise, the software is not going to let you clear it out from your inbox. So we'll go ahead and we will record an action to be taken. So I'll mark this as urgent appointment, for example. Your practice recall policy will dictate which options you can use and select from here. So this really does sort of differ workflow-wise from practice to practice. So yeah, it's up to your practice's policy to determine which options are to be used and the circumstances associated with them. All right, now as soon as we do mark one of these options here, this result will be able to be seen from the patient's record. So once we have actioned it. Now, only our actioned results will show in the investigation reports tab. It's really important when you do have a patient's file open, when you're in a consult, that you're looking out for this notification that says there are unchecked reports for this patient. So whenever you see that, you'll know that you need to go into clinical up the top here, down to unchecked reports, and then you'll see anything that has been unactioned for this patient, no matter whose inbox it's sitting in. So it doesn't necessarily need to be in your inbox for it to show there. So that's really important to be aware of. But we will jump back to our inbox. Down the bottom here, we do have some little shortcuts. So add reminder will allow us to create clinical reminders for this patient to come back. Graph is to view and graph atomized results. Add action allows us to create tasks for this patient. And we do also have the option to add to the patient's past history as well. Now, the Add CST result button is a shortcut to enter in all of the details of the result directly into the cervical screening tab for the patient without having to open their record. So we'll select this one here. And then we need to go ahead and we need to fill out the information in this pop-up. So I will just fill out some example details in here. So you're filling out your details. You do have another shortcut to add a clinical reminder as well. So those shortcuts for a clinical reminder does show up all over the place. And then once you're done, you just click save to that one. So that is a shortcut that saves you from having to come back into the clinical file, open up cervical screening and record it this way. So we can click on our add button in here and that will take us to the exact same screen. But I would definitely recommend recording that directly from your inbox as you are receiving results. And make sure you are recording your cervical screening results because they do need to be recorded in that section. That will also remove any preventative health notifications as well. All right, the add INR is a shortcut that can be used to add INR results, again, without needing to open the patient's record. So once we've actioned that one, we can click next to move down to the next one, repeat that process all over again, and click finished once you're done, which will take you back to the most previous screen that you were sitting on. Now, for instances where you're covering for another doctor, at the practice, you can change inboxes by clicking this little inbox icon along the top here. And then we can switch to another provider's inbox. Best practice automatically creates an inbox for a user as soon as they have at least one result or document sitting in there. So if somebody's name is missing from this list, it's because their inbox is empty. It's not because you're missing a part of the setup or anything like that. But I'll cancel out of there. And then I will just click finish to that one. And you can see that takes me back to the most recent screen. Now, I do have a question here regarding My Health Record. So you would have spotted this notification to do with My Health Record. You will see this notification here in purple if it's been more than 12 months since the last shared health summary was uploaded for this patient. And as you might have guessed, the way to remove that notification is to upload a shared health summary to My Health Record. Now, you do have your My Health Record button in the patient banner. Personally, I find it easier to just click on the My Health Record tab up the top here, and then you have your specific options of what you're wanting to do. So I will click on Create Shared Health Summary. From here, I can create my shared health summary. So I can choose what I want to include. Now, this is really important that you do know how to upload these properly because it is a two-step process. It can be a little bit deceiving. So what you need to do here is you firstly need to click preview. That will put it into the document format. And then you'll notice that you have the upload button here. So you need to preview it before you upload it. This isn't a real practice for me, so I'm just going to cancel out of this one though. Now, that is particularly important too for if you're participating in particular incentive programs, for example, where you need to upload a certain amount per quarter. If you do want to see a count of how many shared health summaries you have uploaded to My Health Record, we actually have a management report for this one. So I'll jump into the home screen of best practice and I'll go into management and then reports. Management, then reports for management reports is how I remember how to get to it. And if we just scroll down to the S section, we have this report here that's called Shared Health Summaries Uploaded by Provider. I like this one. I like it how it's grouped by provider rather than just giving overall numbers. So we can go ahead and we can run this report. I recommend going in and running this report every now and again rather than leaving it to the last minute so that you can see how you're tracking. So you can put your date range in here as needed. Then you can go ahead and you can view the report. I'm more than likely not going to have any data in here though. Yeah, I don't have any data. So you'll be able to see a list of all of the providers in your practice and how many shared health summaries they have uploaded. So that makes it very easy to track that information. All right, we are getting close to the end of the session now. I'm just going to jump back into Bonnie's file and I'm going to go back into today's notes. All right, now you can see that my timer is still running along the top there for this patient, so it's been quite a long consult for them. I'm going to go ahead and I'm going to finalize this visit. Now, depending on how long the visit has been open for, and also depending on what you've done in the patient's clinical file, so if you've done a care plan or a health assessment, for example, best practice will actually suggest the item numbers to bill. However, you can go ahead and you can overwrite this. Now, this is just telling reception what you want billed. It fills out the invoice for them and it leaves a lot less room for any error if you are filling this out. So what we're doing from here, I'm sure you've all done this before, you're just searching for the item number you want to bill and double clicking on it. So you can see that's added it to my items to bill. It's overwritten the original console item that I had in there because, as you'd know, we can't bill two console items on the same invoice. If you're not sure what the specific item number that you're looking for is, just do a search using your keywords over on the right-hand box. So I can search for ECG, for example, and click search. And then it will show me all of my item numbers that have ECG in this description. Main thing is that you remember to double click, not just click once. You can also change your account type. So if this one needed to be bulk billed, for example, but the default will already be set depending on the patient and depending on your settings as well. Now you can double click on an item and you can record service text as well. So you can do that for reception. For example, if we were billing two biopsy items and we needed to record, left shoulder on one, right arm on the other. A bit of a side note here, this is getting very specific with service text, but there are some rules around it. So just make sure you're not recording over 50 characters, including spaces. You don't put any double spaces, so you're not accidentally clicking the space bar twice in a row, and you're not using any special characters like brackets or exclamation points. Otherwise, reception's going to get an error when trying to send them through to Medicare, so just be aware. You can also set up pre-made service text, so you can click on your little ellipses here and select a pre-made one. Now, if you want to set these up, and this is a bit more towards practice managers, but I just want to show you anyway, just under setup, configuration, and then we will scroll down to invoice notes. So that's where you can set up those pre-made ones and just make sure that you're following those couple of rules that I just stated as well. Alrighty, now down the bottom here, this is where you can make any additional notes to reception. So I might say book follow-up appointment with me for next week. And then I'll go save and close. It's giving me a little pop-up here because earlier in the session I created two prescriptions and I didn't ever print them or send them as an e-script. So it's just asking me what I want to do with them. In this scenario, I will just discard them because I do not have a printer connected. And then we can go ahead and we can start our next consult and begin that process over again. Now, just really quickly in the last minute, I just want to show you why finalizing the visit properly is so helpful for reception. So once you have finalized the consult, their appointment will go into a bright green at billing color. Reception will be able to double click. You can see that they've got the note from the provider and it's listed down the bottom there. And the invoice is already filled out for them. So what they then need to do is they need to pay it off if it's private or store it if it's bulk billed. So it definitely makes things a lot easier. Once you have closed out of a consult, if you do need to go back and amend any notes, for example, don't restart the visit. That's going to put it back into a with doctor status and it's going to really confuse reception. And understandably, what you would need to do when you are finalizing the consult, you do have the option to just click save rather than save and close if you want to keep that file open. Otherwise, if you've already closed it, you can open them from the home screen of best practice. So I'll open up Bonnie. You can see I get a little pop-up here saying, there was a visit recorded for this patient earlier today. Do you want to continue adding to those notes? Yes, I do. So I'll click yes. That then takes me back into the same visit, but it hasn't updated the status in the appointment book. You can then go ahead and you can finish off your notes as required. When you close out of this though, don't finalize the visit for a second time because again, it's going to put it back into an at billing color in the appointment book. It's going to confuse reception, and if they're not really keeping track of it, they might think that the patient has walked out without paying. So once you've done your notes, just close out of the patient file. Best practice will save the notes and won't update the status of the appointment. Alrighty, now that does bring us to the end of the session. A nice short and sweet one this was. I can't see any questions in the chat, so that's all good. I do hope that you found this one helpful. Remember, if you do need any assistance from us from any screen in the software, you have the help tab along the top there. You can go down to online to access our knowledge base for all of our step-by-step guides. You can also click on About, which will give you our contact information, so you can call our free software support team. You can also email them as well. But otherwise, I hope you all have a great rest of your day. Bye, everybody.